Dr. Cindy Collins, registered dietitian and health psychologist. A lot of patients undergoing chemotherapy and radiation treatment are interested in knowing how much water they need to drink and how they should stay hydrated. So the old rule of thumb to have 10 8-ounce glasses of water is actually still true, even though we're all a little bit different and we need more or less. During cancer treatment, it turns out that can change even more. For example, if you have a fever, or if for some reason you're sweating, or you're urinating more, and certainly if you have vomiting or diarrhea, you're going to have extra needs. You're going to have need for more water because you need to replenish the water that you're losing. And you don't always have to hydrate with drinking plain water. It could be very diluted juices. It could be herbal teas and things like that. And it's really important to know that even food has water in it. Like, it's pretty obvious that soup has a lot of water, that fruit has water, and even things that you might not consider to be high water foods, when you put them in the microwave and you see all that water on the side of the walls, you realize something even like chicken or a potato actually has a lot of water content. So if you really are having a hard time drinking water, try to also include foods that are very high in water. At some point, you might need to suck on ice chips, and actually occasionally people need to get IV hydration. Now, how are you going to know if you're dehydrated and you're in need of more water? First of all, with chemo especially, you're getting a lot of labs taken, and the labs are very indicative of hydration if you have it. It's really easy to tell. So you might also, though, experience headaches and fatigue. Fatigue is another symptom that's related to lack of water or dehydration. And many times the doctor will give you an IV of fluids, and that really peps you up and brings your energy back and gives you the fluids that you might not have been able to get on your own, especially if you had a couple of days where your water intake was very low. One thing to be really careful about is that if you're going to drink a lot of extra water, which some of us do go overboard, and then we think, oh, I've got to drink as much water as I can, you really need to drink water with electrolytes or other types of water, because there is such a thing as having too much water in the system. Electrolytes are very easy to buy. They come in powder form. They come in droplet form. You can find them in the regular grocery store. That's not hard to find. So it's really important that you do that. That's why some people have turned towards things like Gatorade and Powerade, but we don't always want all that sugar either. This is a great time to see the dietitian wherever you are, because those specific needs can be explained by him or her. The alkaline water isn't really holding enough research right now to say that there's anything so particularly helpful about drinking alkaline water. I wish that that theory behind it was better researched and also more simplified than it seems to be. But your own body is already arranging or maintaining the alkalinity internally, especially in your tissues. So drinking an alkaline water is probably not something that's going to give you any extra benefit.